Today, a CDC advisory panel is backing Pfizer's COVID-19 booster shots for millions of older or vulnerable Americans. And we know a number of COVID patients end up struggling with long-lasting symptoms. They call it long COVID. A study is now underway in several states, including Arizona, on long-haul symptoms some patients may be feeling. And with kids under 12 unvaccinated right now, they may too be at risk for this. So joining us now, Dr. Elizabeth Rice with Southwest College of Naturopathic Medicine. Dr. Rice, thanks for being with us.
Thank you, Christina, for having me.
Of course. So tell us, what are you seeing in your practice right now? Are you seeing many patients with this so-called long COVID?
Yeah, there are many patients with long COVID. They have a wide variety of symptoms that I'm seeing in my clinic, including debilitating fatigue, muscle joint pains, headaches, trouble sleeping. And we're finding out that there might even be upwards of 100 different other symptoms that could be associated with this syndrome.
Yeah, I mean, the data is coming in real time, so it's kind of difficult. What is a treatment plan like for someone who's experiencing these long-term symptoms?
Well, conventionally, there's only supportive treatment since there is no known conventional therapies to treat this syndrome itself. So mostly patients get relayed to a specialty clinic, or there are some specialized outpatient recovery clinics that are starting to pop up. But with natural medicine and at the Southwest College of Naturopathic Medicine, we're treating patients holistically, their whole body, and helping them to feel better from the syndrome with natural medicine.
I'm curious, too, with COVID, are you seeing more patients during this time? This has been going on now for about 2 years, but before, maybe people were more inclined to go to their regular MD, and now they're seeking other treatments because that wasn't so successful with COVID.
Yes, I've seen a lot of patients who haven't recovered from their acute illness fully, and they're seeking out other answers for this. And homeopathy, which is the type of therapy we're using in our study, has been shown in many illnesses that are similar to long COVID, like fibromyalgia, chronic fatigue syndrome, to be helpful. And so that's what we're hoping to see with this study as well, that homeopathy can be helpful for symptoms of long COVID.
And when it comes to kids, much of the data that we're seeing right now, what data we do have with kids, they're unvaccinated, of course, the young kids, and their symptoms with COVID, typically they don't last very long. They're saying about maybe 12 weeks or so. Is that what you're seeing, or do you have any info on that?
Yes, we actually have an international review of the 14 research studies, which were about 20,000 children and adolescents. And you are correct. Most of them recover from their long COVID within 3 months, but there are some that can have at least one symptom that lasts even longer than 4 months. But the good thing is that most children will recover, and even though their acute COVID infection was very mild, they still can develop symptoms for months afterwards.
Are there naturopathic treatments that can be accustomed to children, or something that you can do for them as well?
Yes, absolutely. Homeopathy is very safe in children and even in infants for treating illnesses. And there are lots of other supportive therapies in natural medicine that can also be safe in children.
Okay, great information. Good to know. Dr. Elizabeth Rice with the Southwest College of Naturopathic Medicine. Thank you so much for your time. We appreciate it.
You're welcome. Thank you, Christina.
Take care.